So thank you for your time. Again, my name is Matt McNeel. I run Extreme's U.S. healthcare sales. I can be reached at McNeel. It's a little bit different. So my Scottish heritage must have spelled it a little wrong when it came across, but it's EEL at extremenetworks.com. And good morning to you, good afternoon, good evening, and just glad to spend a few minutes with you here to kind of review some of the simplification of network that we are doing. And Ron, kind of going back to Jacksonville and around Y2K, and that's kind of the reason why I'm here is we're trying to simplify a networking situation, but goes back to a lot of things have not changed in the way that healthcare systems are looking to implement their next generation network. They're very similar to what they were in Y2K. So we're trying to open to new standards, how this is going to drive simplification and security, and find success together as we've been able to grow our client base through the years and go from that standpoint. So a little bit about Extreme. Extreme is a global leader of next generation networking and wireless solutions. We are worldwide in over 180 countries and really has a great history of innovation. I'll go back to when we launched kind of our next generation network at the Sochi Olympics. Sochi 2014, similar needs to healthcare. I've got 250 locations. I've got a guest network. I've got an athletic network. I've got a TV broadcast network I need to support. I've got, vendors. I've got temporary guest passes. And oh, by the way, the athletes, smartphones are starting, right? I've got to get my smartphone on board, but also, either Sony or Samsung or one of those, Microsoft, it might've been Microsoft, gave them a tablet. So not only did we have to support their phones and their typical computers and Wi-Fi's, we had to then on board that additional IoT device in a network that was basically like running a Super Bowl every day for 15 days. And oh, by the way, we did it with 4 people. So it's incredible. It's kind of our coming out story that started our journey into the next generation network with customer number 1, City of Milwaukee. Thank you. That led to customer number 52, ProMedica in Toledo. Thank you very much. And then it carried on to Franciscan and Novant and Penn Medicine and Ascension and all those kind of ones that are out there that led us to over 3,000 global healthcare clients today. So we want to make you aware of these things, finding success, but also the innovation in the networking side came over to cloud. So several years ago, we bought a cloud company that allows you to not only move network management to cloud-based principles and give you those adoption things that you may be looking for, hey, every month I'm going to get an upgrade. I'm going to get new code. I'm going to get, test it out. It's going to be successful as we move to a migration strategy as an operation expense. But also it gives us that flexibility that here at Extreme that you can do things still on-prem and kind of that cloud on-premise choice for networking solutions and be successful that as well. That innovation also drives Wi-Fi. And Ron was mentioning when we first started out about Wi-Fi 6. We were the first ones to release 6. We were also the first ones to release 6 outdoors. And what that's going to bring for us is that not only the next generation, but the added bandwidth, the need for all the devices that are out there to bring on board successfully and have that positive experience for whether it's voice over Wi-Fi or that radiology image that Ron and I were talking about before across the network, and find that success and prioritization that goes along with it. But that along with it is brought kind of to where we are, and where we don't want to be is that Gartner 30%. So I bring that up because in the enterprise and in healthcare, 30% of all digital transformation goals are unsuccessful because the network. It's true. So we can look it up, Gartner, and we do not want to fall into that bucket and kind of introduce new ways of thinking to be successful. And that's our commitment to our customers and clients, that we're going to challenge complexity, and no other vertical that I have been around in my 25 years has the complexity that you do. So thank you for what you do. We appreciate it. We understand it. We know that you are supporting, if you're in healthcare, health system, a leading health system, you're supporting different models, right? You've got acute care, high density campus, you have ambulatory care, you have clinical needs, you have a small doc box in the office, and you also have, I've got to now support remote telemedicine and telehealth needs for, patients. I've got to drive that customer experience level to the next level to help hopefully impact my HCAP scores and be successful in that range, but also have to kind of like that Sochi experience is I've got to maintain a guest network, a clinician, a vendor, a payer, a provider, a certain in-source group, an outsource group, a DSO, a long-term facility, all these things that go into it, but I got to put it into a single network for simplicity. And that's where Extreme has come in to find that success as the complexities are built. Because we know operation budgets since 2019 for nursing and clinicians has increased over 40% of the operation. Our IT budgets aren't going that same way. I mean, we're lucky to get 5%, sometimes maybe 8, 10% based on a project, and we need to do more with less. We need to think about how we can operate, better operations and influence the success of these things as far as complexity. We also know you've been tasked with extended lifecycle management. So this lifecycle management that, hey, I've got medical IoT assets that I've got to maintain, patch. I need to provide visibility, locationing. I need to provide reporting on it. I need to do security analysis on all these things. And hey, it's kind of like I've got to upgrade the network. It's almost like I'm in an airplane while it's flying. I've got to change out the engine. I've got very limited time. So we do appreciate that. We understand some of these complexities. And oh, by the way, we understand that you got to have government compliance and HIPAA compliance and regulation to be prepared if those things are asked of you, from an infram audit to HIPAA surveys to security audits that come into place on an annual basis to help give you information for those things and find success. But we also want to give it at your way and at your pace. We want to give you a chance to hook into your current investment. So we want to leverage your current investment architecture. It's not a rip and replace mentality. We know this cannot happen overnight. We got to leverage those investments, but also give you something as far as a network appliance that can be both for on-prem, but also be managed by cloud. So it's very unique in the industry where I can actually do both in a networking architecture without having to reduce cost, and then also keep a simplified licensing models. We don't have to break the bank to go get a new licensing models and find success in that ways, to find a perfect pace for you and your organization to find success. Because even though we might have 25 or 30 people on our IT staff, or maybe we only have 4, we're all going to do things successfully in a secure manner and find that operational intelligence that's going to reduce risk and find those kind of capabilities that work in your way to kind of build what I call, kind of the allowing your network to do more for you, rather than relying on so many outside sources. So let me shift gears here. From that standpoint. So what we do is we've developed this transformational technology and industry-leading technology that allows for you to have a single network across from your data center, all the way from your acute to your long-term care, to your urgent care, to your clinical care, to that home office. So very rarely in the industry, you have something where you're not layering on complexity or another language or another network on top of a network, but it's something that can be truly unified from a single protocol that can be extended out securely in that fashion. The other resounding factor is inherently secure. Natively, it has inherent security and limited visibility, but it also scales. So that visibility is reduced to a single hop. So what I mean by that is, even though if somebody came into the network in a normal IP standard, they're not going to have visibility to a clinic, that is, 5 locations or 5 switches away. It's going to look like one session away. And due to this, our network has never been hacked. We've hosted hackathons. I don't know, Ron, if you remember some of those that we've promoted over the years. To come in and check it out. We're going to give you some IP addresses. You go try to hack it and figure out how to get there and those kind of visibility tools, and ended up no one is completely failed. So, but that's the inherent security that is layered into the network, but it also provides you the service to scale. So, Ron, if you had a clinic and you needed to upgrade your wide area network, but you needed to introduce a new service, you can now do it at the edge of the network in basically 2 commands. Set it up in the core in 2 commands. You never touch the core of the network, excuse me, at the other site location. So in 2 commands, it basically addresses the new services capability. So that service enablement reduces cost of time for ownership as far as capabilities. And really what we're driving is that secure onboarding and automation. The other thing Gartner promotes, if you ask Barry, Runyon to come on and have a discussion with you in the real-time health system is also automation. Automate everything. And we've taken that practice for zero-touch provisioning, but also what we call network attach. So now you can natively network attach one of our switches. You can attach one of our Wi-Fi APs and an industry standard protocol standard. And also you can do third parties, such as an iPro video surveillance camera. So how easy it is to know that something is secure onboarding, that you have a company that can also get you your guests, your visitors, your medical IoT, and also work with specialists such as Silera, Order, Assembly to kind of find the medical IoT needs and regulations that you need to adhere to and tracking to be successful, but also provide you that what I call reporting both on-site and through the cloud of business insight. That's going to give you what we call explainable AI and ML. That's going to give you that database of information as you talk to a business leader or you are a business leader. That's going to give you the informatics to be successful and that visibility to have conversations and see how things are tracking, whether it's applications or tickets, as we look to integrate these kind of services into ServiceNow and to do things like automatic RMA as we find troubles in your network. And it's all done, obviously in a 24 by 365 leading support network. Also, but how we do it, I kind of look at it like this. I don't pair individually, but we pair a dedicated healthcare team with our industry-leading GTAC. And our industry-leading GTAC is different because it is 100% insourced at extreme. As you follow the globe, all these folks are, it's very hard to do, insourced extreme badge employees that work for our corporation, which makes us very successful. And is really one of my favorite, we do a lot of things with Gartner, but one of my favorites is obviously we are the leading, Peer Insights is how they rate support in the industry for our support services. So what I like to do in Viewpoint is I run actually a dedicated healthcare team. That's all we do is live in healthcare. We don't handle government accounts, K-12, sports and entertainment. We are focused only on healthcare, primarily acute care and long-term care services and urgent care facilities. And when we work with them, it's not just about extreme. We look at them and pair with them to obviously maximize your federal dollars. We work with a company called FG, for example, where we're going to run proprietary reports to give you your funding model for the Healthcare Connect Fund, for example. We have our own grant writers that can work with you to find success in grant writing. These folks are also immersed in telecom expense management, so to help you negotiate carrier services, annual bills, all those things. This offers millions and millions of dollars. We have found almost, between our partnerships between these different organizations, almost $100 million annually to help promote to savings, but it also gives us things to do what I'll call, and Barry likes to call in the real-time health system, build a command center maybe, where I want to have incident response and visibility into my network. All that goes into play. So we work with those things, we maximize funding, we deliver a single network and scalability. Remember, 2 services on, 2 services off. We secure automation and onboard this application performance that's actually going to increase the more things that you have on it. So the bigger you scale, actually faster the network runs. Won't get into it on this call, but it basically gives you that scale and stability that you need. But also that support system, because we do things specialized for healthcare where we do what we call a golden release, where we actually test out certain route switch codes to make sure they're stable for performance for verticals such as healthcare. So if there's something specific, whether it's an Epic instance or a certain application that we need to find successful, we'll actually work with our Envision team to find success with you to make sure that we have those kind of specialized code levels to be successful in that manner. But the whole simplification obviously has led to what I call network nirvana. And the sisters of the third order of St. Francis, what I call do not lie, right? So as the third, the sisters at OSF, and OSF is 24,000 strong. It's 15 hospitals, 147 locations. Came to Extreme with, like a lot of us, they have an aging infrastructure. They had an aging infrastructure. They had, it's highly complex, all the locations, needs, and had a tremendously rising operating cost to maintain this legacy network that was Y2K. So how did they kind of partner with Extreme? Well, they looked for us to kind of not only do their, network transformation, but we wanted to do it over 3 years. And we wanted to see if we can, that was a strategic goal for us. But what we found as we started to work together and you got to know the technology, that we ended up doing all the facilities and remotes in 18 months. And we found, and they can, continue to do a tremendous job, is when we could actually turn a 350 bed hospital, acute care hospital, in 8 hours, meaning turn from one technology vendor to a new technology vendor for land transformation. And then no package dropped. Obviously, there's a lot of planning that goes into this, a lot of good resources at OSF and their partner Point Core to find this, what I call network nirvana, which is, we're going to drive automation and on secure onboarding. We're going to minimize security risks, but we're going to do it without and reduce costs, but we're not going to sacrifice one for another. So it's one of my favorite quotes and how we found success and what we look to do for our clients across the board as we get to know you and get to work with you in the future. Also, obviously, OSF and others reached across to, hey, Whisper, can you do this? Who are you going to whisper in, right? So Gartner's one of those folks that they whisper in. And I just want to make you aware that we are in the Magic Quadrant. It's the upper right for LAN and Wi-Fi, and have been there consecutively for the last 4 years. We have surpassed some of our competition here lately, and the newest one is not out yet. It came out last November 15th, so any day, the updated one. So hopefully we will be making it 5. And a lot of that is around that, cloud transformation, day 2 operational maintenance, visibility into the network to find success. But as I mentioned before, that we find success with our GTAC supporting you in that environment, and going back to that relationship of a dedicated teams, but also dedicated support. I'm very fortunate to have, folks like Jamie Roxborough and team that I can call up in Canada, that, hey, we have an issue going on, that they've been with us along with my, over 20 years here at Extreme. They've been right beside me. So we've lived through a lot, we've learned a lot, but also gives you that advantage of that personalized service that you can actually, feel like you can grow and be successful as you have your digital transformation needs and need to meet those strategies as we continue to grow and onboard new devices and folks and deliver new solutions, whether we're going through mergers and acquisitions or we're just in general looking to find success of the real-time health system, which we strive to adhere to here at Extreme. And lastly, in closing, I hopefully that we've given you some insight about reducing some of these risks, right? Looking at simplicity as a positive to growth, but also giving you that prescription for networking success, that I'm going to have something that I can use on a cloud or on-prem based system. It can scale to 16 million service IDs versus a traditional network with a little over 4,000. It can partner with third parties for true integration and support and visibility of segmentation. So that whole, what we are driving towards hyper segmentation can all be a part of our solution set and be successful with as we look to provide you those next steps. So Ron, I thank you for your time. I know it's a lot of talk here, but obviously these slides will be available to you. And I'll get that over to you, Ron. And remember, you can always reach out to me at email, or I am on Twitter. I'm also on LinkedIn. I don't get in there as much as I like sometimes, but I do obviously respond, and we'll be looking forward to some conversations if we do get the chance here in the near future.